Welcome to this presentation. I'm Maria Laura Lousada from the Center of Epidemiological Studies in Nutrition and Health from the University of São Paulo in Brazil. And I will present the NOVA 24-hour screener, a new tool to monitor and benchmark population diet quality on behalf of the population diet module from Informas. In 2013, the Informas team published a paper highlighting the importance of monitoring population diet quality between countries and over time. In the expanded and optimal approaches, the dietary share of ultra-processed foods is measured as an indicator of energy-dense and nutrient-poor diets, using both household budget surveys or food intake surveys. However, the paper also highlighted that more work was needed to improve both data collection methods and diet quality indicators. And today, 10 years after this paper, there are more than 10 systematic reviews and meta-analyses showing the association between high dietary share of ultra-processed foods and increased risk of many chronic diseases such as diabetes, cardiovascular diseases, hypertension, and also all-cause mortality. Despite all these advances, a major challenge still remains regarding population monitoring. The use of comprehensive tools, complex tools, such as 24-hour recalls or even food frequency questionnaires to evaluate food consumption is difficult, costly, and not visible in many countries. That is why we are now developing simplified, short instruments and indicators that could be used to monitor and benchmark the consumption of ultra-processed foods. The first indicator is the NOVA score for the consumption of ultra-processed foods. The NOVA UPF score is the number of groups of ultra-processed foods consumed during the previous 24 hours, not including information on amounts. It is calculated with the application of the NOVA UPF screener, and it was designed to be a proxy of the dietary share of ultra-processed foods. And the NOVA screener presents a list of 23 groups of ultra-processed foods, and these 23 items make up more than 95% of the total ultra-processed food intake in Brazil in 2008-2009. The NOVA screener was developed to be responded with clicks of the mouse or touches in the screen by individuals or by the interviewers. And the questions addressing the intake of each of these groups are presented on 3 categories: beverages, products that usually replace meals, and products that often are consumed as snacks. And we first tested the NOVA UPF score in a small convenient sample of only one city of the southeast region of Brazil. And now we have expanded the validation to the whole country, and the results are published in the second paper, whose results I will present to you now. So the validation study was conducted in a subsample of 800 to 12. Sorry, I will pause and say this slide again. The validation study was conducted in a subsample of 812 participants of the Nutrinet Brazil cohort study. The participants answered to the NOVA screener, checking all items within the list. And they also answered a 24-hour recall that was specially designed to capture food processing. And in this 24-hour recall, participants informed all foods and beverages and the amount they had consumed in the day before. And the performance of the NOVA score was evaluated comparing it to the actual dietary share of ultra-processed foods that was assessed with the 24-hour recall. And in this population, scores ranged from 0 to 15, but you can see in the figure that 0, 1, 2, and 3 were the most common. And this figure shows, as expected, a linear association between the dietary share of ultra-processed foods and the NOVA score. In other words, the average percentage of dietary share of ultra-processed foods that was calculated based on the 24-hour dietary recall increases linearly and significantly with the increase in the NOVA UPF score. But more important than that, the analysis that you can see in this slide also showed a substantial agreement when individuals were classified and comparing according to quintiles of the dietary share of ultra-processed foods and quintiles of the NOVA UPF scores. This is demonstrated by a PABAC index of 0.79. That is considered substantial. And after developing this first score, and based on the principle that a healthy diet should focus on all forms of malnutrition, we also built a second score focused on measuring the healthy dimension of the diet. And this score we call the NOVA score for the consumption of unprocessed or minimally processed whole plant foods. And this score corresponds to the number of subgroups of unprocessed or minimally processed whole plant foods consumed on the day before by individuals in one population. And it was designed to be a proxy of the actual population dietary share of these foods, and it is calculated by the application of a second screener that we call NOVA WPF screener that has 33 items, and these 33 items of this second screener also represent the most unprocessed or minimally processed whole plant foods consumed in Brazil according to our National Food Intake Survey from 2008-2009. And the questions addressing the intake of this group are presented on 4 categories. The first comprises fruits, the second leaf vegetables, the third other vegetables, and the fourth legumes, whole grains, and nuts. And the validation was described in the same paper that described the validation of the UPF score with the subsample of the Nutrinet Brazil cohort study. NOVA WPF score presented a normal distribution ranging from 0 to 20 food items consumed in the day before, and only 18.1% of the participants consumed 10 or more items. And this figure shows a linear association between the dietary share of whole plant foods and the NOVA WPF score. So the average percentage of dietary share of whole plant foods calculated based on the 24-hour recall increases linearly and significantly with the increase in the NOVA WPF score. And the agreement between quintiles of the dietary share of whole plant foods and quintiles of the NOVA WPF score is also very good. The PABAC index was 0.72, that is considered substantial by the literature. And lastly, we assessed the performance of the 2 scores in predicting the risk of excessive weight gain. And this study was carried out in more than 9,000 participants of the Nutrinet Brazil. And they answered the 2 NOVA screeners and reported height and weight at baseline and also after 15 months of follow-up. And in this graphic, you can see the association between weight gain of more than 5% that we are calling a high gain of BMI in the period between the baseline and 15 months of follow-up. I will say this slide again, sorry. In this graphic, you can see the association between gain of more than 5% of BMI, that we are considering a high gain of BMI in the period between the baseline and 15 months of follow-up, and both scores. Increasing quintiles of the NOVA UPF score, that you can see in the blue line, were linearly associated with higher risk of excessive BMI gain, whereas increasing quintiles of the NOVA WPF score, that you can see in the gray line, were linearly associated with lower risk. And in Brazil, the NOVA scores are already incorporated in our surveillance systems, that is in Vigitel, that is a telephone-based survey, PENSE, that is a school-based survey, and also PNS, that collect data on face-to-face interviews in the whole country. Now the NOVA UPF screener is being adapted for use in other countries such as India, Senegal, Ecuador, and Canada by local academic institutions. And to support these researchers, we have developed a protocol. And in this document, we describe how the NOVA screener should be developed and tested for content, face, and also criterion validity. Briefly, the investigator should first analyze and adapt or even replace items from the existing NOVA UPF screener, the Brazilian screener, as needed. And food examples can be an aspect to be adapted in order to improve the understanding of the local participants. And data from population-based studies such as POF that we use in Brazil, that is our National Food Intake Survey, maybe also use it to inform these processes, and other data sources, including market surveys or even literature review, could also be used to guide decisions in this first phase. Then a context-specific group of experts should be invited to review the NOVA UPF screener in order to assess the appropriateness of the adapted tool. And this process will help estimate the content validity of the tool, and revisions or corrections should be made following this phase. And for face validity, a purpose sample of 10 to 30 adults should be recruited to provide detailed inputs on the clarity and interpretability of the NOVA UPF score. Input on the appearance or design of the tool should also be requested, and data should be analyzed, and suggestions for improvement of the tool should be incorporated before further testing before the next phase. And lastly, field workers should be recruited and trained to collect data with the aim to determine criterion validity of the tool. A total sample of more or less 300 adults may be recruited to first respond to the NOVA UPF screener. Then their responses will generate the individual score that corresponds to the sum of the consumed items. And the data collection staff should then administer the 24-hour recall to the same sample. And this will help generating a measure of the dietary share of ultra-processed foods. And so the criterion validity of the NOVA UPF screener will be evaluated through the comparison with the 24-hour food recall that is considered a superior method for measuring dietary intake. And lastly, simple correlation and agreement analysis between the score of the screener and the dietary share of ultra-processed foods from the 24-hour recall should be run. And for this step, it's essential that the 24-hour recall captures sufficient information in order to identify the ultra-processed foods, and the countries must have good food composition tables in order to estimate the energy intake in the 24-hour recalls. And to finish, the screener can be easily administered using Google Forms or similar apps. But despite that, we are now developing a web platform to make them easily available together with other instruments that you evaluate food consumption according to NOVA. And thank you. This is my email for contacts.